Hello and welcome to your favorite doctor show on television. It's time for We the Doctors. My name is Dr. Jules.
And my name is Dr. Okay.
I'm Dr. Yvonne.
My name is Dr. Valeria.
All right, and we'll be talking about something very special today. We know what you guys do. You take tips from your friends that play doctor, or you Google your symptoms. Yes, we know. But we are here to demystify all that and help you get the facts about medical symptoms. And, you know, you don't have to use all those false practices anymore. I'm mumbling today. I don't know what's wrong with me. Anyway, we were talking about male participation in antenatal care. Okay. And before we go into that, we'll be talking about a little tip where we'll be giving you some tips about medical practices.
I think it's good. We just call it Doctor Says.
Yeah, Doctor Says.
And what we do in Doctor Says is that we find a topic that is away from the topic, something different from the topic we're discussing. And we'll give you 3 truths of medicine in Doctor Says. So I could start with, okay, let me start by telling you what today's topic is. In today's topic, we'll be asking you, what do you think has more germs than a toilet seat? So when you want to answer, you just say, Doctor Says.
Like this. Doctor says, Doctor says, Doctor says. The car steering wheel.
All right, enough of this Doctor Says. I think it's high time we get back to business, the reason why we're here. And then, like Dr. Joseph mentioned earlier on, today we're talking about male participation in antenatal care.
Yeah.
And then we realize that a lot of time, men do not usually go with their partner to the clinic for antenatal.
Exactly.
They really are indifferent about the whole thing. And we want to know the reasons why men do this. Basically.
There's a research that has been done about it, actually. And then we'll be talking about those factors one after the other so that people get to understand. And those people that make their decision not to even attend antenatal or child care with their partners, they would know where they fall in, and they will teach you how to, you know, make a better decision about it. Now, the first thing we'll talk about is peer pressure.
That's very important,
Well,
Dr. Jules.
when you say peer pressure, what do you mean? Because I think I would say reverse peer pressure.
Absolutely.
No.
We are never there together in the first place.
So where does your peer pressure have the role?
No, your discussion with your friends. As in when you're discussing with your friends at home, they influence your decision.
Okay,
Just
so if
like
I'm getting you right, what you're trying to say in essence is this. It's just a situation whereby a man tells his friend that, look, I'm going with my wife to go and see her doctor.
Exactly.
And then the guys go like, see her doctor for what? Are you sick? I mean,
you
it's a woman
pregnant?
thing exactly.
Yeah,
basically.
Yes, that's
And then I think that should even take us to the next thing. The men also feel in these discussions that their job responsibility will not let them
permit them.
Yeah,
Absolutely.
But don't
Then-
forget that some of these women that go to antenatal clinic work too.
They
Please.
work too.
Don't
And
forget.
they
Yeah, but most of the time, you know, in a lot of cases and a lot of homes, it's the man that provides for the family.
for the family.
So
I
you don't
know
want
where
to
they are
joke with the
coming
man
from.
who is bringing in the money. You say you want to have your baby in the best of hospital. This man is working there. You still want the same man to come and be sitting with you.
And get to think about it on a Monday morning. You find a husband and the wife hand in hand.
Where you can be
walking
signing
to
deals
antenatal,
and doing
So
better
just to
businesses
sit
and all
down,
of that.
Very
and then the
romantic.
whole work
Very,
day
very,
is gone.
very romantic.
I understand what you mean.
We'll be talking about the advantages of accompanying your partner. But let's just talk about the factors first.
Exactly.
They are just being manly men by talking about it like this. But anyway, also long waiting times in antenatal clinics has been one of the factors.
I joined my wife severally
Okay.
in antenatal classes.
Oh,
And
nice.
I think
that's bold enough
Yeah,
for you.
and that's
I guess
all.
maybe because you're a doctor, that's probably why you went anyway.
the first time I was bored, and bored meaning being from the patient relative side, because all the while I'm used to antenatal classes being the doctor seeing the patients. But this time I'm the one sitting in the back, and then I watch them, they call them, they go and dance. Obviously I won't dance with them. They take all those lessons.
And to be honest, the male partner does not really participate in that experience. They just basically sit.
And then you find a good hospital and lots of women there.
Yes.
So
No,
the
you know what?
yeah.
It just teaches you patience. You should just be
Yeah, exactly. Well, we'll teach you how to use that time maximally here on the show. So you don't have to go there and think you're burning time. We'll tell you what to do with those times. And then some guys also feel like the visits are repetitive, monotonous. Why do you have to go all the time?
Because I mean, think about it. Sometimes, like every 2 weeks, then it gets to a particular stage, you're going every
weekly.
week.
Yes.
I mean, just going to go and sit down with your wife, and the doctor will call.
Just sit down,
You know, you're wasting
Valeria.
time. You know, she can come back home and tell you what went on. But that's to record whatever the doctor said.
But you know,
talk about it. That's the way some men and breathing.
I really
Absolutely.
find it hard to believe guys when they say that, because think about it, their normal work lives are monotonous.
Exactly.
Everything you do is monotonous.
Yeah, but you know,
The drive is
you don't
monotonous.
confuse activity with productivity.
What does that mean?
Monotonous, you are having
No,
you are being active, following your
Dr.
wife. But you are
Valeria,
productive, bringing
There's
money
a family
for the
productivity
family.
in antenatal
Can I
care
say
also.
something? You are welcoming a human being to
You
this.
know.
What can be more
Antenatal care is different
important?
from labor. We need to get this thing straight.
Antenatal is what? It's different from labor.
It's different from the labor itself.
It
No,
is
but
the
no.
journey.
But let's
Dr.
get,
Valeria.
and now that you've talked about labor, I think another thing guys do is that they are afraid of the hospital.
Yes,
There's this morbid fear. In medical
called,
terms, we like
Absolutely.
this nosocomophobia. It's one
Yeah.
long term.
Please, Dr. Yvonne, can you say that?
Simple,
Oh, I
forget
said
about saying it.
nosocomophobia.
Simple
The fear of
English,
hospital.
fear of hospital. That's what it means.
Why are
do
they
you have to use
scared
the
of
big
the
grammar?
hospital?
See, the thing is, it applies to a lot of people. Children are scared of hospital. Some women actually
Women are scared of
Men
hospital.
too.
True.
But
It's when you are pregnant,
Yeah.
you find out you just have to be in the hospital.
That's
If not, how do you get the
exactly.
baby out?
Okay.
And that's why they go, I think.
that's
They
why
get
they
to
go.
brave it.
Yes.
Okay.
Everybody's scared of hospitals.
Yeah, but the
or
man is
many
not the one
people are
that's
scared of
pregnant, so he might
hospitals.
as well just opt out and decide not to go.
Okay, now that we've outlined the factors, it's a good thing that we're going to talk about how to use this time productively. So if you are listening in on the show, you want to go to cooltv.cool, or you want to go to Twitter and just use the hashtag WTD and leave your questions there, because we're going to treat them on the show. So when we come back, we will be talking with Dr. Yvonne, who will be giving us the reasons, explaining more the reasons why men do not participate in childbirth.
In the labor room.
In the labor room. That would be an interesting one. And we also have more Doctor Says for you, so you don't want to go anywhere. We'll be right back.
Coming up next.
Men do not participate in antenatal care and childbirth. We've actually been talking about a very interesting topic, reasons men do not participate in antenatal care and childbirth. We talked about antenatal already, so now we're facing the labor room. Why men do not participate in the labor room. Anyway, I'll be giving the first reason I think they don't go into the labor room. It's because of anxiety. Most times men are anxious, especially first-time fathers, if I may say. Yes, first-time fathers. And so sometimes they actually will pass off this anxiety to the women. And this could actually cause a bit of complication, because you know adrenaline is released. Adrenaline actually reduces the production of the hormone responsible for contraction. Do you understand? So there may be delayed labor, and you now start hearing, okay, they have to take her for a CS or something. So sometimes they just decide to stay out.
Okay, it's a first-time
yes,
father.
and
Yeah.
the first time, and I'm just watching the way she's just describing
No, but it's
the whole
true.
thing.
It's okay, it's
Now,
a first-time
when-
father.
I'm sure it was because you're a doctor. That's why maybe it would have been easier for you. But even
Yeah.
then, your adrenaline
Even
would have been higher.
forget
Exactly.
being a doctor. I
there you
was
go.
anxious.
No,
I had not just anxiety, I had everything. And the way she's busy describing adrenaline as if it's a nice thing.
No, but you know what I'm
It's really
saying?
not a nice thing.
Okay.
But for people who are not doctors, I think the fear of blood is a
Okay.
big factor
Okay.
for them. Yes,
Yeah.
they don't
Okay.
want to have blood with them. And just think about it.
Right.
They just know this baby they are going to love all the days of their life is going to come out with blood wrapped around it.
Yeah, I
But
know.
apart from that, they don't want to see blood.
At all. Some people
We've
even
had
faint.
instances where,
Yeah,
exactly,
some
where people faint in
Yes.
the theater,
Yeah.
in the labor room, and then we are beginning
Yeah.
to struggle between the woman on the table delivering
the-
and then the
We don't
man,
have to handle
and then the man on the
two
floor,
patients
and
at
then
the
the
same
baby
time.
coming out. It's
Yeah.
Absolutely.
Yeah,
But
sometimes-
another reason, well, just saying from the men's side, sometimes even the women don't want their husbands coming into the labor room.
True.
The fear that it can affect the sexual performance
Yeah.
and all of that. Imagine the man staying there saying, coming out, and the man is going, does this,
I have a
go back the same way.
confession
Exactly.
to make.
Oh, let Dr. Jules, okay.
I have a confession
Over
to
you.
make. Okay, my husband wasn't there. That is my fault. I didn't let him come
pushed him out.
because on the two false occasions that we had, he was a patient.
Really?
So I don't want to worry about bringing my baby to life and I'm counting his pulse on the side.
But you know,
That's just too
sometimes
much
you let go.
responsibility.
When you are delivering, let him do the worrying. Just
Ah.
worry about the baby. And
Oh, really?
She's already
And he will
she
now
doesn't
be
have to
on-
And then you have another
Then
Don't
also,
worry.
some things that actually affect is the cultural practices.
Yeah, exactly. Especially in the north, they feel as if antenatal and childbirth is a woman's affair. And a guy is not supposed, apart from the northern northern part of Nigeria. Even in the south, some people
Yes.
feel
Yeah, there are all
there's
sorts of-
no point to be there, to be honest.
Yeah.
So,
So these are many more reasons actually why
Yeah.
men do not go into the labor room with their partners, so to say. We are encouraging you to go in. For those of you that don't even want to go at all, but if there's a mutual understanding not to go, then it's fine. So this is all we'll take on this segment. Then we'll be going over to the streets. We want to hear interesting things people have to say about their presence in the labor room with their partners. So we'll be going back to that soon.
Actually, I will not like to be with my wife in a labor room.
I don't like it.
Yeah, of course. Why not?
Obviously, yes, I would like him to be there.
All because of the stress they are going through.
Once that I'm seeing my husband, I cannot deliver now.
Because we are into it together, so I want him to be there, see what I'm going through.
After all, she's carrying my baby. So, of course, I'll be there with her.
I cannot stay with my wife when in the labor room.
Yes, I would like to be in the labor room with her.
I don't want to. Yes, it's a good idea.
I'm responsible for the pregnancy, so I'm supposed to be with her if they need be.
You know, it will make the man to know the value of the woman in a home.
Because that is like 100 years, that only one day.
Then when my husband, they see my naked, they don't pass. If I enter the bedroom, no.
Yes, I would love it.
Yes, of course.
Yeah? Not actually.
Yes, I would like him to be in the labor room with me.
Well, I've been there twice.
So when he's there, I'll be happy not to be afraid when I want to put to bed.
If you are at home alone with your wife, then you will be in labor room with her. You have to assist her for everything till she delivered.
So that he will know what I'm going through.
Because he might not be able to bear the pains that I'm passing through there.
Maybe because I want him to see what I go through when I'm there.
I think it's a life-changing experience. You come to appreciate women a whole lot better. You come to respect the almost divinity of a woman, because it's amazing to see someone give life, and it's something that if any man should have that chance, you should just experience it. It's amazing.
Welcome back to our show. It's with doctors, and now we have guests with us. We have people that will be telling us they are really living today's topic. So we want to hear, what they have to say. We're talking about male participation in antenatal care and also in childbirth. So in the studio with us, we have two guests. We have Onyinye Odafe, who is in her pregnant glory, here to talk about her experience in antenatal care, and then Rita Basi Umet, who just gave birth and is here to tell us her experience as well. Welcome, guys. Thank you for joining us.
Thank you.
Okay, let's start off with Onyinye. You are, yesterday you actually went for your antenatal care. We just want to know if your husband ever went with you for those visits.
Actually, it depends.
Okay.
Like the hospital where I use, the husbands, they have their own parts to play.
Okay.
Especially the aspect of blood donation.
Okay.
So the husband, they have to be there. They go through the normal screening. They ask them questions. They counsel them.
Oh, beautiful.
Yes, about what pregnancy is all about, what they should expect from their wives.
Beautiful.
How to take care of the women when they're pregnant.
Wow.
So that's the aspect where the husband have to be there.
Okay.
Now, let me ask. When the ladies are dancing upstairs, do they get the husbands to play football outside together and bond with themselves?
No, they have their own section.
And
the guys have their own section?
They have their own section,
okay.
Yes, where they counsel them, educate them about what pregnancy is all about, especially the first timers.
Okay.
So they have their own section.
Okay.
Yes.
How many visits did he come with you to the antenatal clinic?
That counseling is just for one day.
Okay.
But whenever he's around and he's less busy, he always wants to follow me. But I feel it's a woman thing. I mean, why would you want to follow me to antenatal all the time?
Are you serious?
No, but in your opinion, do you think he's following you, even that first time, has helped in the way he has related with you during this pregnancy?
Yes.
Yes.
That's a good thing.
Yes.
And now, I feel from what you just said, it means that the hospital kind of encouraged the male participation more and made you understand the benefits as opposed to you. Were you expecting him to join you, or when you waited for the hospital to encourage him?
I waited for the hospital to encourage him.
Okay, so in your perception, you didn't feel...
I didn't feel he's supposed to be there.
necessary.
It's a woman thing.
But it's important to know it's not every hospital that would ask people to come.
I know.
And some hospitals have reasons why they don't want people the husbands to be there. I don't know the reasons.
That brings me to Rita. Rita, welcome.
Thank you.
How was your experience in antenatal care?
It was wonderful,
Okay.
I would say. The attention given to pregnant women was, they really took care of us, like checking your blood pressure every time, checking your urine to know if there's sugar level and all that. Yeah, it was really good. But it was when I was about to give birth, I know they didn't allow my husband into the labor room with me.
They did not allow your husband. That was the hospital's policy, not...
Yes, the hospital policy.
Okay.
Did you get any reasons for that policy?
They didn't give us a reason.
Wow.
Okay, and...
But I heard the nurses saying they want you to be strong, to face it yourself. Because some women, when their husbands are available with them, they bite them in the hand, they do
That's demonstration of strength.
What? The women, they bite their husbands, pinch them, they do a lot of things to the men. That is why they don't allow them in the labor room.
So they are protecting the men by not allowing
Yes, they are
them
protecting the men.
Okay,
no, but
interesting.
Looking back, do you now think that the absence of your husband in the labor room changed anything? Or if you had been there, would you have improved or changed anything?
No, it helped me. I would say it really helped me.
That's a strong woman.
It helps you by him not being...
Because, okay, I would say when a woman is sick, like if I'm sick now and my husband is not here, I'll try to be strong. But if he's there, I'll be acting babyish. Yes, but when he wasn't there, it made me strong. It made me go through the pain myself, seeing life in another aspect. Like you're here to save a life. What if you're just you, just try and save this life?
Okay.
It made me see reason to life, like, this is me. If there is nobody else without me, can I save someone?
Okay.
Yeah.
Oh, wow. That's an interesting way to look at it.
Let me push it down to Onyinye now. Is this your first pregnancy?
This is my first pregnancy.
This is your first pregnancy, and you've heard her story. And you're on camera and want you to tell us, would you want your husband to be there in the labor room?
I wouldn't want him to be there because he's just me, my God, and me alone.
But in the creation,
what
was
of the baby?
you and him.
Me, yes, me, my baby.
You couldn't have made the baby yourself.
What's okay? He's been there. What is he going to do?
Don't you feel it's going to be supportive and for him to get that experience to see, what you're going through? Because there's a school of thought that when the man is there, there's the support. Some people actually go through the training to learn how to support women that are put to bed because of this purpose. Don't you think him shouldering that burden would help you in some way?
To me, I wouldn't want anybody to be under tension. So
how considerate.
Okay.
I wouldn't want anybody to be under tension.
I would ask a personal question for the audience. How many weeks are you now?
40 weeks.
40 weeks. Let's find out if the audience wants the cameras to be in there during your delivery. What do you think? So you guys, you want us to have the cameras in there for that delivery?
Oh, wow. I really appreciate you guys for coming because we just wanted an insight of, especially the Nigerian woman of today, their perception about our topic, which is male participation. From what we hear, we know that our women are very, very strong, but we still encourage the men. Please, you have to support these women. And when we come back, Dr. Valeria will be giving you the tips and the reasons why you should be there there and the questions that you should ask, because you don't want to wait until the childbirth time to ask those questions. So you want to learn the benefits of being present. Remember, you can give your questions on Twitter by hashtagging WTD or go to cooltv.cool and click on We the Doctors and leave your questions. Don't change that dial. We'll be right back.
If you're just joining us, this is We the Doctors, and my name is Dr. Valeria. Now, doctor says, doctor says, doctor says. Doctor says that your phone has more germs than the toilet seat. Now, I know that sounds very awkward, but that's the truth. Sure. But that's not the reason why we're here today. We're talking basically about male participation in antenatal care. Now, on this segment called Where There Is No Doctor, we're going to be telling you what to expect when you're expecting as a man. We're going to be telling you reasons why you should go to antenatal care with your partner. Now, one of the first things we expect you to do as a man is that we expect you to discuss antenatal and perinatal interventions with your partner. And what we mean by that is basically this. You know, some women will want to have their babies in some places. Some women will tell you they will want to have the normal spontaneous vaginal delivery, meaning that you don't want the baby to pass through, they don't want to go through the pain. Some will tell you they want cesarean sections. Some will tell you, I don't want to have my baby here. I want to have my baby in this particular part of the world for whatever reason best known to them. So you need to discuss what you want. Like the lady said earlier on, she doesn't want her partner being with her during the course of labor. So you need to discuss, those things with your partner, and then you know what to expect when you're expecting.
True.
Now, the other thing basically is this. You need to support your partner.
Financially, it's very, very important, financial support, because most of these women are not working. Some of them are full-time housewives, and so they need money, support. They need to buy so many stuff. Not just for that, they have lab investigations to perform, so many things. So she has the burden of having to think about this whole thing herself. Then it's not to think about finances again. So she needs support. So if there's any way she can get support from her partner, it will be helpful.
I also think it's important to understand your wife's body.
Okay.
People have bodies that change, different bodies for different people. And the fact that your neighbor's wife does all the cleaning in the house doesn't mean your own wife will be able to do the same. So basically, understand her bodies. Parts of her body is going to be painful to her. For example, you won't be grabbing the breast the way you used to before she got pregnant, because they'll be sore during this period, they'll be painful. Also, sexual intercourse might have to change. This is not the time you decide what role you are playing. This is time she decides what role you should play. So some may want you to be that vigorous as you used to be before. Others may say, no, want to go gentle. Some others will say, let's forget about this thing for a while. You really have to understand your wife's body. And of course, no is always no. But it starts off with your understanding what her body needs.
So basically, what you're talking about in essence, that you need communication, and then you need to understand what the person is going through at that point in time. So sometimes when you come back home from work and you're expecting your big bowl up on the yam as usual, and she's telling you, look, I can't stress myself, I can't do all of those things, you don't go out of.
They are not going to remind her of your neighbor's wife who is 70.
Exactly. People are not the same. Another thing that is important as well is for you to make sure you understand the woman's vital signs. By vital signs, we're talking about their pulse rate, blood pressure. There are basic things that they check during antenatal. They also check things like the urine sugar. These things they will tell you if the woman is hypertensive or if she's dealing with at risk of having gestational diabetes. That's diabetes that pops up during pregnancy. So all these things are important. You don't want to wait until she's in the labor room to be asking these questions, because you have to be ready for whatever comes into play, the intervention to deal with these complications. So in essence, ask.
Yeah, in essence, what you're trying to say in essence is that once you go into antenatal care with your wife, you get to meet with the gynecologist early enough, and then you discuss some of those things, and then ask about
handling the labor.
Yeah, because I know that during the course of antenatal care, they check the genotype.
Exactly.
They check for rule out HIV, rule out hepatitis, which is very important.
That some people even get married and they don't even know their genotype.
Very true.
Absolutely.
So
when the baby comes up and they start having surprises,
exactly. They don't even know. Forgetting that there are things like resource factor and the rest of them. Things like that.
Absolutely.
Exactly. So those things are very.
It's really important. And I think on the final note, one of the things you need to discuss is this. A lot of time people get carried away. I mean, immediately after pregnancy, 6 months after a while, after delivery, 6 months down the line again, they're already pregnant. So you need to discuss family planning options with your gynecologist, basically. So sometimes you don't always, want to rely on the fact that she just gave birth, she's still covered for a while now. You can meet surprises anyways along the line.
People have met those surprises.
Absolutely.
We tell patients about lactational amenorrhea. When you're not seeing your period and you're breastfeeding,
so you
the possibility of conceiving is low, but some people still get pregnant. So I agree with you. That's the perfect time to ask your doctor what family planning method you guys want to start.
And these days, people don't even have 6, 7, 8 children anymore. People try to put their mouth where their money is, basically. So you can do 2, 3. But then afterwards, you want to know for a proper way of planning your family and saying that you're done with kids. So I think that's about it on this segment of Where There Is No Doctor.
Hello guys, and welcome back to the show. It's We the Doctors. During the course of today's show, we've been talking about antenatal care and male participation in antenatal care. And during this period, we've had lots of people send in questions already on our platforms, social media platforms. Is it really important for him to be with me in the labor room?
Talked about that already.
Yeah, we've discussed it, but I think one thing that is important, let's let Ifeoma understand that usually when men are there with you in the labor room, it changes the way they see you.
Absolutely.
Seeing the pain you go through, it improves care. Even after the baby has come, he understands, what it takes.
I hope so.
I'm talking from experience.
You're the best person to answer it.
Right now, I'm talking. Okay, but you are the lady. But you said you pushed. You didn't let him come in.
No, because I was trying to come from the perspective of the woman, and that was why I also understood where the ladies were coming from. Rita
when they said,
but I know, if given the option, he would want to stay through it and brave it out. But he was also grateful that I didn't call him to come in.
The truth is, it's difficult to brave it out. It's really very difficult to brave it out. But I was there, and it has improved the way I see my wife. It has improved the way I see the baby. It's like a bonding thing eventually for us.
But at the end of the day, it's not everybody that has such courage. So it's all about mutual understanding. Just discuss. As in, if it's fine for you to be there, if it's not fine, then...
And if she asks that you should be there, please brave it out and be there with her. So that has been our show for today. If you've been with us from the beginning, we've been giving you the Doctor Says tip. And I'm going to round up with the last one. Doctor says that the kitchen sponge has more germs than the toilet seat.
Wow.
So you want to change those soft sponges as often as possible. So that has been our show for today. We talked about male participation in antenatal care. Thank you, Onyinye, our guests, and Rita. If you have more questions, please go to our website. It's cooltv.cool and click on We the Doctors and drop your message on Twitter, #WTD, and ask your questions, and we'll get to you. From myself, Dr. Jules, and my colleagues, we're saying bye-bye and stay safe.